Option for breast reconstruction post-mastectomy for breast cancer is available to most women. Women have many options for reconstruction. However, most of these reconstructive procedures require repeat visits to the OR. These procedures can take place at the time of mastectomy, before or after other treatments, or even many years later. Breast reconstruction can include implants or flaps, or a combination of both. A mastectomy may leave a shortage of skin that would prevent the creation of new breast mound. When this is the case, a tissue expander can be placed under the skin to stretch out the tissue. Following surgery, the tissue expander is gradually filled with normal saline until it's filled to the appropriate size. Then it can be replaced with a permanent implant. If the mastectomy leaves enough tissue, permanent implant can be implanted without the use of a tissue expander. This procedure will be discussed in more detail later. A flap that contains skin and muscle are called mycutaneous. There are several mycutaneous flaps that can be considered for breast reconstruction. The latimus dorsi muscle is a wide, flat muscle in the upper back that can be used for breast reconstruction, usually in conjunction with an implant. Another flap option is using the superior gluteal artery perforator, the SGAP. The standard TRAM, or transverse rectus abdominis mycutaneous flap, is the most common pedicle flap used in breast reconstruction. With this pedicle flap, or standard TRAM, the blood supply remains intact. With a free TRAM flap, a segment of the deep inferior epigastric perforator vessels are carried with the rectus muscle for a transplant. In either TRAM procedure, excessive tissue is taken from the lower abdomen to construct the breast. These procedures are usually done without the use of implants. However, they may be needed if the patient does not have adequate abdominal tissue. Tissue for new nipple can be recreated locally by raising a flap or be grafted from the other nipple. The areola can be reconstructed with skin grafts or tattoos. This is usually the last phase of the breast reconstruction. Some hand cases are done by plastic surgeons, some by orthopedists that specialize in hands and wrists, and some even done by neurosurgeons. We'll talk about a few of these cases that are routinely done by plastic surgeons. Replantation is an attempt to reattach a completely severed digit or other body part. If you ever find yourself or a friend in this situation, wrap the amputated digit in a wet sponge and place it on ice and take it with you to the hospital. The usual order of surgical reattachment is bone to bone, tendon to tendon, vein to vein, artery to artery, and then nerve to nerve. Dupuytren's contracture is a localized formation of scar tissue around the tendons in the palmar fascia. As the Dupuytren's contracture progresses, more of the fascia becomes thickened and shortened, and ultimately can make it impossible to fully extend the fingers. The goal of the surgery is to incise and release the constriction to restore mobility to the hand and fingers. It is a painful condition affecting the tendons on the thumb side of your wrist. It is also referred to as texting thumb. Surgery involves a procedure in which the surgeon will inspect the sheath surrounding the involved tendon or tendons and open the sheath to release the pressure so that the tendons can glide freely.